Welcome to Public Health Matters, where we talk about matters in public health. My name is Jane Goodman, Public Health Strategist with the Nashua Division of Public Health and Community Services. I'm joined today by Sascha Potzkas, Public Health Nurse at the Division. Welcome, Sascha.
Thank you. Thank you for having me today.
I'm so glad you could join us. Tell us first and foremost a little bit about yourself and what you do for the Division.
Well, I'm one of the public health nurses. We have a few available at our department, and we all are cross-trained to work in every field of nursing related to public health. So obviously we have the STD program, we have an immunization program, we have a lead program, and then we also do all the disease investigations for the city of Nashua. Now I am specifically the point person for our STD, HIV, and hepatitis C program.
Okay. So currently, because we've been kind of all hands on deck on COVID-19, what have you been doing?
Well, primarily COVID disease investigations. And then I've been working since the summer, we've been slowly going back to offering our STD clinics.
Okay. So we're going to talk about that because, I mean, we do want to get back to other diseases have not gone away while COVID has kind of taken the limelight. We want to start bringing back, in fact, we brought back a lot of our immunization clinics, a lot of our mobile clinics. We've been able to bring those back over the summer, continue into the fall. We've had flu clinics. So now we do have this STD clinic. So tell us a little bit about that. We're going to be doing it we're in temporary quarters at Public Health. So we have a partnership, which first and foremost we should talk about.
Yes. So because we're not able to use our clinic at the 18 Mulberry Street location, we have partnered with Lamprey Health, and they've given us some space to use on Thursday evenings between 5 and 7 to offer like a full STD service where we can do physical. We'll have a nurse practitioner. We can offer physical exams, testing, and treatment for STDs.
So that's awesome. So can you just elaborate a little bit when we talk about a sexually transmitted disease? What is included? And I mean, that's a pretty big bucket. So what diseases are included in that?
So HIV, chlamydia, gonorrhea, syphilis, herpes, and then we also offer hepatitis C testing, which is not necessarily considered an STD, but it can be transmitted that way.
Okay. So we've got this full gamut, and we need to bring this back because it's very important, right? Sexual health is very important and not to be overlooked. And there are not very many clinics right now.
Correct. One of the biggest issues people are having is access to services, especially low cost or no cost services. So we did start offering a lot of our testing and treatment during outreach over the summer, and we continue that on a weekly basis. But we haven't been able to do the full services with a physical exam option. So we'll have that opportunity now.
So that's great. So it's not just the test anymore. It's going to be a full service exam and the test.
Correct.
That's great. And then you have the counseling afterwards. And what about treatment?
Yes, we have all the medications available for treatment. So we do full treatment, including, so if, for example, if you have symptoms of chlamydia or gonorrhea but test negative, we can actually treat you for a non-gonococcal infection or bacterial vaginosis. We have multiple other infections you can get that can be treated in our clinic as well, that we can't do during outreach.
Yeah. Okay, so that's great. So this gives us a little bit of a home for a while, as we are under renovation on Mulberry Street. So this will be at least until we're back into that building, hopefully, if all goes well. So tell me a little bit about the cost. You said free or low cost. If I want to pay for it or if I can't pay for it, like how does that work?
The services we offer are free or low cost. So certain services we have to charge for, like herpes testing, because we don't have any funding for that. Other services like chlamydia, gonorrhea, HIV testing are, currently no cost because we have funding for that. But that can change at any time, in which case we do a low cost service.
Okay.
However, we never turn anybody away for inability to pay.
So I've been very curious about this in-home HIV testing because that sounds very new to me, at least, from my perspective. It used to be a blood test back in the day. So tell us a little bit about how you do that in home, what the process is.
So it's a great option for people who aren't able to come to the clinic. So right now it's available for anyone in the greater Nashua area. They call me directly and I ask a few questions, and then they'll get a test in the mail, which is discreetly packaged. It doesn't say anything about what it is on the outside. And it's simply like a cheek swab. So you rub along the gums and into the cheek, and it takes 20 minutes for the results.
So do they get it actually in their house?
Yes.
And then is there any confirmatory test afterwards? Or?
Yes. So if they test positive, they need to call me back, and then we'll come out and we'll do a blood draw. We'll either have them come to our clinic or meet them at their home, and we'll do a blood draw within 24 hours.
Wow.
And that then gives us the confirmatory testing, the blood test.
That's incredible. Have you had a good uptake on using that home test or
Not yet. We've had a couple calls. Only one person actually has received the test so far. So we're hoping that to get the word out there more, because I know there's a need for it, especially with people in more rural settings. So currently it's available to anyone in the greater Nashua area to call me, and then the Manchester Health Department's offering the same program for anyone in the greater Nashua Public Health region.
Okay.
And then once it catches on a little more, then it's going to be open to the whole state eventually.
Yeah, well, that's amazing. I hope that goes well and that we can reach people. So if you are a provider, or if you do have somebody in need of an HIV test, or you think that would be a good thing. And I love the idea of the anonymity of it, that you get it at your home, you can take care of it, kind of get an answer. And having that answer soon is really important, because people need to take proper precautions. If they know they're HIV positive, they need to use proper protection when they're sexually active and all of those other things. So knowing your result is very important.
Not only that, but getting your result early is very important, because the sooner you get into treatment, the sooner your viral level will come back down to undetectable.
Okay.
And when your viral level is undetectable, there's less transmission and less health problems.
Right. So it's kind of sounds like any communicable disease that we're talking about. It sounds very familiar, right?
Yes.
Like we want to know, just like we ask people to get COVID tested if they have symptoms. Are there any symptoms of HIV that people might detect that might, like, ring a bell with them and say, I think I need to get a test?
So initially, when when you're first infected, you most likely will not have any symptoms. Some people start developing fatigue, weight loss will be some of the earlier signs. And then, so once you become more advanced, once your viral level goes up, you'll have more complications, like you're more prone to pneumonia and other illnesses because your immune system gets weakened.
Okay. So it's just some people don't even know how or why to seek out the test. So we do want to let you know that you can call 682-2885 to speak to Sascha, and you can discreetly send them the kit in the mail. You can also set up an appointment for the clinic. So we'll circle back to the clinic. It is by appointment. It's only a 2-hour time frame. So in order to manage people coming in, we do ask that you make an appointment. You can call Sascha. Is there another way? Can they make an appointment online? Or I wasn't sure about that.
We do have a form set up online, and it will be posted to our website.
Okay.
So that I think we'll have that completed by the end of today.
Yeah, I'm pretty sure that's pretty sure I talked about that
So
with somebody today.
we don't have the exact link yet, but we will have that completed by the end of the day today.
Right. So that'll be on our website, and we just really want people to know that if they need these services, or if they work in an agency where they have clients that might need these services, this is really an opportunity to reach, a lot of people in need. And we are open to, I noticed that you had mentioned this, we're open to everyone.
Yes. So we're open to all populations. So it doesn't matter what your race, your ethnicity it is. It doesn't matter what your gender or gender identity is. And it doesn't matter what your sexual orientation is. We want everybody to feel comfortable coming to us. We provide the best services that you need based on what your gender identity is, what your sexual preferences are, and how many partners you have. So don't be afraid to talk to us and tell us everything, because it's all confidential. And the more we know about your sexual practices, the more we know what tests to provide for you, what treatment to provide for you, and how to best care for you.
Yeah, that's great. So let's just review that so people know again. It's STD, HIV, HCV testing, counseling, and referral every Thursday, starting next Thursday, right? 5 to 7 p.m. Lamprey Health Care, that's 22 Prospect Street. We're fortunate we're going to have someone from Lamprey come on after you and talk to us about the other services that they have. It is by appointment, and you can find the link on our website, or you can call Sascha directly at 682, again, 2885. So Sascha, thank you so much for all the work you're doing and for getting this back moving. It's a really important thing for our community, and it's kind of probably a nice break from disease investigation. but anyway, we really hope that we can get some clients there that'll take advantage of this service. And again, thank you for all the work you do. We'll be right back in just a few minutes.
We're all just trying to keep things running for those who rely on us. That's why we don't have time to be sick with the flu.
We don't have time for delays. Ready!
We don't have time for spills. Next.
We don't have time for setbacks. Let's be real.
Getting the flu shot
Helps you fight the flu.
Get a flu shot for yourself and those around you too.
Welcome back to Public Health Matters, where we talk about matters in public health. I'm joined now by Greg White. We call CEO or director.
I'm the CEO.
CEO of Lamprey Health Care. Thank you so much for joining us.
My pleasure.
You guys have been tell us a little bit about Lamprey Health Care and about you and how you find yourself as the CEO of Lamprey.
Well, Lamprey Health Care is what's called a federally qualified health center. That means we exist to serve people in the community that may face barriers to care. Oftentimes that could be just there's no care in the community. So in rural areas, you'll see a community health center. In urban areas, it may be that certain neighborhoods aren't well served or folks face barriers around language. But more often than not, it's about insurance and folks that lack insurance or resources to pay out of pocket. So that's why we exist. So Lamprey was formed 50 years ago in 1971. We actually were a referral bureau first because people in the community needed to find care for their community members. We shifted then into a transportation service that brought people to care, and from there we evolved into actually a community health center in Newmarket. We grew there and then moved westward into Raymond and ultimately into Nashua in the year 2000.
Okay, so you've been in Nashua already over 20 years.
Yes, we have.
Wow.
So
we could have a virtual birthday party this year.
we're working on it,
or
actually.
an anniversary party.
Yeah, let's see how the virtual events go, but that's our intention for sure.
Yeah, that's great. So tell me about your role at the health center and how you ended up there.
Sure. So I'm the CEO. That means I get to kind of oversee the administrative and kind of the overall mission of the organization. I report to our board of directors, and with us we have 180 teammates, as it were, spanning medical providers, behavioral health providers, administrators, nurses, billing folks, front office folks, outreach, you name it. So pretty thrilled to be in that role. I've been here about 7 years. I started my career actually as a CPA. I was an auditor and began my career thinking I was going to be auditing banks and kind of big corporate enterprises. And the firm that I went to work for assigned me to small nonprofits, which was a little puzzling at first, but I found myself in areas that were, maybe a little depressed, the inner city, but with organizations that were helping people, particularly around healthcare, and my parents' background was finance and healthcare, so I was like, wow, this is kind of neat. I know a little bit about this. So my first clients really were community health centers in the Boston area and northern Massachusetts, and when the opportunity arose to go to work for one of them as the controller, I took it. So I've built my career in finance. I was the CFO at the health center in Manchester for many years, and A couple of stops later, I find myself being the CEO of Lamprey Health Care, and kind of feel like it's a capstone to a career where, you know, I've grown up in community health, but now I get to work with an organization that serves my home community, and to me that's very rewarding.
Yeah, and before the program we were talking about that you are from New Hampshire.
I am.
Born here, stayed here.
Raised my kids here, so
Yeah.
Milford through and through.
Awesome. So that's great. And so tell me about Lamprey. So we're in really strange times now.
For sure.
With the COVID-19 pandemic, it's very much affected our community and affected the work you do. So how are you doing that post-COVID?
Sure.
We're not even post-COVID. I'll say, I don't even know how to say that, during the pandemic.
Certainly. So back in March, when this kind of all got started, we did a quick pivot and really kind of, I wouldn't say close things down. We never closed. We felt it was very important as a safety net provider that we stay open, but with very much quite a bit of concern for the safety of our patients and the safety of our staff. So we ramped down our activity pretty significantly in the first weeks of the pandemic. During those first 2 weeks, we pivoted a lot of staff to working remotely. We brought telehealth online. It's amazing. It was a project that was in the works for years, quite literally, and when we had to, we turned it around in 3 days.
Wow.
So obviously we worked the kinks out of that, but since then we've seen our activity come back to normal. We had gone down to about 30% of our visit activity for a period of time. We're back up to pretty much where we were to begin with.
Wow.
Over the summer, we were about 25% telehealth, 75% in person. Of late, we've shifted back, so we're 60 to 70% telehealth right
Okay.
now. We've elected to maintain a defined list of essential visits that come into our building because, you know, getting kiddos their immunizations.
Yeah, you can't do that over the
our
internet.
OB patients
Right.
are very important that we see them.
Right.
So we've continued to do that. We've actually augmented a lot of our services in terms of the things we're doing. We have a screener at the door now. We've done a lot in the way of providing supports for our patients. We're distributing food. We've never done that before.
Oh, really?
But we're working with local organizations like N68 Hours of Hunger, United Way, the local integrated delivery networks to hand out food because, you know, during the beginning of the pandemic, folks were concerned about getting out just to be able to eat.
Right.
So we've done that. We've kind of given out some care packages for kind of self-supports while you're quarantining. A little bit of that. Our behavioral health activity actually has been very brisk all along and is almost 100% telehealth right now.
Okay.
So,
And that's really important.
For
That
sure.
doesn't drop. And because I think behavioral health issues, when you're quarantined or you're really trying to stay at home more, can really escalate. And so you just really need to be able to reach out to your provider and to be able to have that telehealth. And of all things, you know, the speaking face to face, you really can do, provided you have the right technology, pretty effectively.
we've found that the providers, the clinicians rather, and our clients like it. We found historically we have kind of a tough no-show rate for some appointments, and this one has improved quite a bit with telehealth capacity. So I'm not sure if it reduces a barrier or if folks are just more comfortable or it takes transportation challenges out of the equation.
That's true, right?
It does not suit everyone. We have some frail elders that, while we might be able to provide them with a smartphone, you know, their vision might not be good enough, or their hearing might not be good enough to kind of work with an electronic device. So it doesn't fit for everyone, but it's been a great solution for many.
Yeah, that's great. So do you take insurance at the healthcare center?
We do. I like to say that, you know, we provide care to everyone regardless of their ability to pay, and that means not just if you have no insurance or if you have Medicaid, but we contract with the Anthems and the Cignas of the world. We serve Medicare patients. We full charge patients, you name it.
So I just think that's important to know because it's not just for the medically underserved.
Absolutely.
This is for the full community. This is a service. This is a health center that serves all of Nashua, really greater Nashua.
Greater Nashua and parts of the Seacoast, yes, across the southern tier of the state.
Right. So you oversee all 3 centers?
Yes.
Okay. So they're all under one umbrella.
So we've got 3 primary sites, Nashua, Newmarket, and Raymond, and we've actually got 3 additional sites that we've added in the last few years. We have a partnership with Greater Nashua Mental Health, where
Nice.
we've put primary care in their building and have common clients there. That's gone very well for the last 2.5 years. We have recently added a site at the Nashua Soup Kitchen that went live in the fall. We're very thrilled to be over there. And I've just recently started a similar integrated site at the Center for Life Management in Derry.
So how does that work at the soup kitchen? You just like have a room there, or somebody meeting you, clients are meeting you there?
Yep. So right now we have a room. We send over a nurse, a medical provider. In this case, it's a nurse practitioner and a community health worker who go over once a week. And I hate to say set up shop, basically, are available
say
to
that.
people
We understand.
as they're interested in visiting with us, and accessing or providing access in that environment's a little different than a medical office, obviously. So we kind of respond to patients or people's needs as they present. They aren't necessarily our patients, but they might need some assistance facilitating kind of the system in terms of getting health care or other services that might be available in the community. So at some point, we do anticipate delivery of a mobile health unit next month. So that might help us do a little bit more of that.
The big bus you get?
Not the big bus,
Okay.
but more the size of an Amazon van.
Okay.
Probably
That's
a
like
little-
what we have at the health department.
Yes,
we have
exactly.
our mobile unit, and we
You
go out
got
with
it.
immunizations.
Hope
and
to
things
work
like
with
that.
you on that, actually.
Yeah, that would
because
be
it's-
fantastic.
We strive to complement services, not duplicate them. So.
Right. And that is like something that I'm noticing as you're telling me. It's, everything is better in partnership. And so, and being able to meet clients, for example, at the soup kitchen. Sometimes you just have to meet people where they are.
Where they're
and that
at,
even
exactly.
making that, 2 extra blocks away, they may not have that capability. And so meeting them where they are, bringing the healthcare to them,
Yep.
it's just such a service for both, really it's a win-win for the soup kitchen and for Lamprey Health Care and for the community.
For sure, and then being able to provide a breadth of services when you are in contact with them, because oftentimes the opportunity to see them again might not present itself
Right.
immediately. So hence, we're distributing food in partnership with others, or substance use treatment services or an integrated behavioral health program that we operate at a primary care level, but partner with other organizations as complexity increases, we refer and work together in meeting the needs of our clients.
Yeah, so it's really, it's such a vital, I would say, vital service. So I know that there are a lot of other services. One thing that struck me, of course, prenatal care.
Sure. So we have a model of care where we try to employ family physicians, and in many other parts of the country, family physicians also do obstetrics. So your family doctor is also delivering babies. You don't see that so much in the Northeast, and when you do, it tends to be a community health center. So at a number of our sites, we do employ physicians that do provide OB care. We also employ an OB/GYN at each of our locations, so that we can handle the complexity and kind of the higher risk things, and then work with the local hospitals and OB groups to either back us up or deliver the babies at the hospital. So we deliver across our system about 300 babies a year.
Oh, wow.
Yep.
It's almost one a day.
Yeah, I was going to say, and we'd love to do more. So we do that, and actually that was kind of the impetus for some of our medically assisted treatments work in terms of substance use treatment, because we were finding a number of our prenatal patients were having trouble accessing that service other places due to the complexity and the risk of a prenatal and that treatment. So that's why we added that in Nashua first and have since grown it to our other sites.
And then I see also you offer medication-assisted treatment for
Yes.
substance misuse.
Yes, so we do Suboxone and Vivitrol. We do kind of a full encompassing type of treatment modality where it isn't just the medication, but we offer counseling that goes with it. I think our folks are very proud that we don't force anything on you, and we don't turn you away if you stumble a little bit. It's more about working with you to get you to a better place. So we've had that going for 2 years now.
And do you do that in partnership with Greater Nashua Mental Health, or how
So
does that
the
work?
substance use treatment we do ourselves, but we actually have some common clients between us, so we do work very closely with them, and I suspect we might have a few that visit us at the Integrate site, which is our partnership in their building. So.
Yeah, because I mean, often those two things go hand in hand, the
yes.
substance misuse and the behavioral health. So just another area for partnership.
Absolutely.
And then you did mention something about a nurse practitioner fellowship.
Yes.
So when you went, just tell us what that means.
So Lamprey Health Care is also the host agency for the Southern New Hampshire Area Health Education Center, which is a grant-funded entity that promotes workforce development. So over the years, that program started in medical interpretation many years ago, moved on to getting middle school kids interested in careers at healthcare, particularly nursing. That's since evolved into behavioral health care, so they actually run summer camps to get kids involved with that. They do a training program for community health workers, which I know the health department now has several more.
We just hired 2 more. Yes, they started last week. It's awesome.
Outstanding. We have an entire team at our place too, and love the work they do. So as part of that, we note that primary care providers are tougher to recruit these days, and there are many great schools in the area graduating nurse practitioners. But with a physician, you come out of medical school and then have 3 or 4 years of residency to kind of get acclimated to practice and kind of build up your proficiency and your self-confidence. Nurse practitioners come out of school after their 5th year of college and have had some clinical rotations, but we found that we were having a hard time retaining them because they weren't ready to maintain a full panel of patients, particularly in, I would say, a fast-paced practice. So we developed what's called a Nurse Practitioner Fellowship, where folks who've recently graduated from a nurse practitioner training program, they are nurse practitioners, they are licensed, do a post-grad year with us that takes it a little slower, but gives them an opportunity to learn what it's like to manage a panel of patients kind of in a continuity way across the period of time. And we expose them to rotations in the community with specialists, helps them build networks. It helps them understand, when's a good time, when should I be referring this patient, when should I be treating them here. So we are in the process of recruiting our 4th cohort of nurse practitioner fellows. We were very fortunate to receive a federal grant to help us expand the program. Right now we have 6 fellows in the program this year. We aspire to grow that to 10.
So they must receive a salary.
They are paid.
Yeah.
We protect them in terms of any sort of variability. There's no production requirement in terms of what a provider might often see. And there are some didactic sessions too, where they sit and they do case studies. They'll have a lecture on something pertinent in the clinical area, particularly with community health. COVID was a big one, or social determinants of health is another. I think we've talked about ACEs, which is adverse childhood experiences and things like that, so that it helps ground them a little bit and build the breadth, with our intent of building and replacing our own workforce, and if not ours.
Do you get people to stay once you've trained them?
We've had 4 stay with us.
So that's fantastic.
And we're actually thrilled to say we've had a couple actually work at clinics in the community that are not us, but they stayed in the area, which is also important.
Right. And that, to ground a new practitioner in public health, because I think federally qualified health centers are at the heart of public health, because you do look at everything. You do look at the social determinants of health. Like you said, you're giving out food.
Right.
You're probably helping with transportation for clients if they need it. So I think to ground new practitioners in public health and in those important things that you provide, and to do it in, like you said, a measured fashion so they can kind of ease into it. That's amazing. This is all new for me, but I'm really happy to learn about it.
We're very excited, and actually it's proven to be an opportunity to retain some of our longer serving folks too, who have gratified teaching and being able to kind of impart their experience and kind of their knowledge on the next generation.
Yeah, because I think that I know in my own medical family, they like to teach.
Right.
And to share that knowledge. It is very gratifying, and to pass that on. And, and to know that you've, left it in capable hands or that kind of thing. So
For sure.
that's an amazing program. I'm really glad to hear about that. And the final thing that's on the list, you talked about the Public Health Network, and
Yes.
you're part of it. And obviously, I know I would be lying if I didn't say we're part of the Public Health Network too, because the seat of it is at the Health Department.
Yes.
But tell us what your activities are with it.
So much like Nashua, the City of Nashua is the host organization for the Public Health Network in the Nashua region, and I believe they oversee some substance misuse prevention, as well as emergency medical preparedness, COVID response.
Oh, yes.
We are similarly the host organization in the Seacoast. So in Raymond, we host the Seacoast Public Health Network.
Oh,
so we have folks on staff that are doing similar activities. We're probably not as big as the health department in Nashua, but our folks are leading the charge in terms of the fixed sites for immunizations. They do a lot of work in terms of the mutual aid network of fire departments and first responders in terms of being prepared for these things.
Right.
We do quite a bit of work with outreach around substance misuse prevention. We've done a lot of work with teens in the last couple of years, and I believe over in our region we're looking at vector-borne diseases, so Lyme disease.
Lyme disease, yeah.
Was a big topic for us to look after, and one of the unfortunate things too is that I know in the Exeter area, youth suicide has been a terrible problem, and thus a focus of our community health network. So we're looking after projects around that and working with the partners like the hospitals and the mental health centers and some of the housing organizations to what can we do better there.
Yeah. So you guys are in 2 public health networks, really.
We are.
You run one, part of another.
And we're proud to be part of the Nashua team too. I think we work very closely with Bobby and the folks at your department, and certainly the planning is always great to be part of that. So
Yeah, and I think what people probably don't understand, but New Hampshire has a growing, developing public health system, and they many years ago they put into place these public health networks, and so they're statewide. There's 13 in the state. I hope I have that number right. And
that's the last number I heard.
Yeah.
Yes.
So Manchester, for example, is the seat of the Manchester Region Public Health Network. Nashua is the seat, like you said, and Raymond, you are the seat of
Seacoast,
the Seacoast Public Health Network. And so these public health networks choose their issue areas. Emergency management is in everyone across the board. And then there are other issue areas based on what the needs are in your region. So it's, I'm learning so much today having you here.
We're busy, yeah.
You are busy, that's for
I think
sure.
the neat part about these public health networks is that folks might not know that most of the state, I think there are only 3 health departments across the state that are municipally run. So Nashua and Manchester are 2 of those. So we band together as a collaborative to address regions with the other 11 public health networks because the towns themselves don't have a public health department.
Right. And then, like you said, in times like these, where we are really under full emergency management and like putting together vaccine clinics or COVID testing clinics in our case right now, we do that as a public health network. So this has been amazing for me to learn more about the health center. I knew a little bit coming in, but I will admit I learned a couple things.
Great.
The health center's on 22 Prospect Street.
We are at 22
And
Prospect in
also
Nashua.
in Raymond and Newmarket, but folks that see this will be in Nashua, so
For sure.
it is open to all,
It is.
regardless of ability to pay, regardless of race, sex, ethnicity. Please, this is great healthcare, folks. So please call and make an appointment for your needs.
Please do.
And Greg, thank you so much. I hope to see you on the other side of this pandemic without a mask someday. We were saying before the show that we only have heard each other's voices on calls. But I really appreciate you coming at the last minute and filling in. And I also want a big shout out to Lamprey for partnering with the division on the STD clinic.
Our pleasure.
Because we are kind of in like strange office space right now that is just not suitable for a clinic.
Certainly.
So we appreciate the space and the willingness to work with us on that
We're happy
until
to
we
work
get
with
back
you.
on Mulberry Street.
Happy to work with you.
Thank you. And so that's all we have this week. And just a reminder, if you would like a COVID test, we do have a clinic every Tuesdays from 3 to 5 p.m. We have moved to 154 Daniel Webster Highway, the National Guard Armory. You can make an appointment online, or you can call our hotline at 589-3456. In the meantime, please be safe out there. Wash your hands. Stay home if you're sick. Wear your masks. And stay 6 feet apart from those who are not in your family. Thank you so much. Have a good weekend.